Welcome back to the Dr. Rich channel. Today, my team has searched the internet and found a popular medical drama, Chicago Med, with a OBGYN related topic. So we'll see how accurate this is. Let's check it out.
This is what I get for trying to take on a 12-pound pot roast.
Good news is it's just a second-degree burn. Might blister and swell a bit, but you'll live to cook another day.
BP's 160/90.
Let's page OB, have him take a look.
All right, not sure what's going on so far. So it looks like she burned herself. She looks somewhere in her second, maybe early third trimester, and has high blood pressure. So there are conditions in pregnancy that you can have an elevated blood pressure. It may be that you always have that and you just have chronic high blood pressure. There's another condition called preeclampsia, which can actually end in pregnancy loss, stroke. And so that's a condition where if that is the cause for the elevated blood pressure, needs to get evaluated right away.
You're 7 months along?
Yeah, why?
Are you okay?
Oh, everything's okay.
Yeah.
Your wife's
Third
blood pressure
trimester.
is slightly elevated. I'd like to get some labs and an ultrasound just as a precaution.
Is that necessary? I've been seeing my doula regularly, and she says everything's good. I'm right on track for home birth.
I know. You must think we're some granola-fed hipsters, but that's not it.
My sister miscarried after an amnio, and I promised myself I would do everything as natural as possible.
So, I mean, that does bring up a couple of interesting, perhaps controversial topics. So in Western medicine or industrialized countries, we have access to the most advanced healthcare available, testing, monitoring, particularly in obstetrics, that leads to better outcomes than the developing world where those technologies aren't available. Many patients will forego that and do a birth plan with a non-physician. Births have been happening for centuries before there ever was a specialty of OBGYN. But in as much as there is technology now that can give better outcomes, it's the standard of care. It's what our society recommends, is to get care through a medical provider. In this case, it sounds like she had a problem, a relative had a problem. Amniocentesis is a diagnostic test where fluid from the amnion can be sampled, and you can determine whether the fetus is genetically normal, if there's Down syndrome, if there's some other genetic anomaly, and kind of make a decision based on that information. All medical testing does carry some risk. And in this case, she believes that the subsequent miscarriage was due to that test. And so understandably, she has some concerns about testing.
Includes protecting my baby from the harmful sound waves.
I understand completely.
Well, and that does need to be cleared up. Ultrasound is completely safe in pregnancy. There have been hundreds of millions of ultrasounds done in pregnancy. It is definitively safe for evaluation, detection, for diagnostic purposes in pregnancy, and can detect any number of anomalies, and definitely should not be avoided. It's completely safe in pregnancy, and that is misinformation. So you should not avoid ultrasound during pregnancy.
What's up, Ethan? What you got?
Amanda Kendrick Dobbs, 7 months pregnant, gravid belly, history of fetal movement and Braxton Hicks contractions, all signs of a normal pregnancy.
So what's the issue?
There's no baby.
Okay, so this is, I guess, one of several things. So patient came in pregnant, had an arm burn. They did an ultrasound. It looks like they're not seeing a pregnancy on the ultrasound. Obviously, you would confirm that with a blood pregnancy test, which I'm assuming they did, which was non-pregnant. There are several reasons where someone would not be pregnant, but showing up in the ER saying they're pregnant, and we'll see which one of those this is.
Notice how she didn't ask about any test results or anything?
Oh,
Yeah.
yeah.
That's because on some level she knows the truth.
So what are we looking at?
Well, no grandiose delusions or other signs of underlying psychiatric illness, so I think we can rule out psychosis.
Then how is this even possible?
Well, in a lot of cases, the anxiety produces a hormonal reaction, causes all of the physical signs of pregnancy without a growing fetus.
We need to figure out why having a baby is so important to her.
Or, more specifically, why being pregnant is so important to her.
So at this point, we've got a patient that comes in, physically appears pregnant, says they're pregnant. Sounds like they believe they're pregnant, but they're not pregnant. So how is that possible? Well, the differential would include secondary gain, like someone has a need to be pregnant somehow that is getting them some benefit. And that could just be in terms of sympathy or monetary gifts or something as simple as that. But that's, a deception. They know that they're not pregnant and they're holding themselves out as being pregnant, which it doesn't sound like this is, because she actually has some of the symptoms of someone who would be pregnant. The second one, which she mentioned there, was some type of psychosis. So there's a psychiatric disorder where it is a mental illness where the patient falsely believes they're pregnant. And then there's another category, which it sounds like maybe it's called pseudocyesis, where it's a condition that the patient so desperately has the need to be pregnant that the mind causes the body to develop the symptoms of pregnancy, which can include a distended abdomen, 7 months, even full term. The patient can have, nausea. They can feel fetal movements or what they perceive as fetal movements. They can actually even have milk discharge from the breast. So all these things can actually happen in the body without even being pregnant, causing the patient to reinforce the idea that they're pregnant, and they truly believe they are, but they're not.
Our bodies are complicated. Sometimes signals get crossed and our brains say one thing and our bodies hear something else.
I don't understand. Is there something wrong with the baby?
Yes, well, not exactly. It's complicated.
What exactly are you saying?
So this is kind of made for TV. It's induces this gut-wrenching pain of the ultimate delivery of the news. It's a challenge because these patients are so deeply invested in the idea that they are pregnant that simply telling them they're not pregnant doesn't dispel for them what they've accepted as reality and what they actually have physical evidence to support, even in the face of clear, definitive medical evidence like ultrasounds and pregnancy tests.
Explain, Dr. Reese.
I am sorry, but there is no baby.
We lost the baby.
No, you never had one.
You don't know what you're talking about.
No, see, the evidence is actually right here. You have a condition
Medical
called
evidence.
pseudocyesis.
Pseudocyesis?
You may have heard it referred to as a hysterical pregnancy.
Are you saying my wife is crazy?
No, she's not. She's not saying that at all. She's saying that sometimes the mind has the ability to play tricks on the body.
I can feel my baby. I don't care what this ultrasound shows. Your machine must be broken.
I can assure you it's not. Your blood test confirmed.
Well, then your lab's broken too. 'Cause I'm pregnant. I am.
Honey.
No!
Hey, back off.
No!
Honey.
No!
So again, this is very dramatized for television, but not that far away from the response that you would expect a patient who has invested months into believing that they're pregnant and having done so outside of the healthcare system, which would have caught this months and months ago. But the fact that she was getting home care delayed that process, and patients feel like that is a loss to them. It's kind of weird. I don't know if the ER doctor, the OBGYN, and the psychiatrist drew straws to see who would break this news. This would definitively be the OBGYN's job to inform the patient of the non-pregnancy. And it is a process where you are probably not going to get them to believe you when you break the news. And there needs to be a ongoing counseling process, not necessarily psychiatry, but some type of counselor who's going to be able to have multiple points of contact where they eventually get to understand that it's not a pregnancy. So make sure you subscribe and turn on your notifications